This information is for educational purposes only and is not a substitute for professional medical advice. Please consult a healthcare provider for personalized guidance.
Have you or someone you know ever experienced sudden, unexplained bleeding or bruising? Maybe you've faced mysterious nosebleeds or had trouble stopping a cut from bleeding. These might seem like isolated issues, but they could be signs of a rare and serious condition known as Acquired von Willebrand Disease, or AvWD. Today, we're diving into what AvWD is, how it differs from other bleeding disorders, and what you need to know to stay informed and proactive about your health. If you've ever wondered why your blood doesn't seem to clot properly or why certain symptoms keep popping up, stick around. This information might be crucial for understanding and managing your health better. What is Acquired von Willebrand Disease, AvWD? AvWD is a rare bleeding disorder that stops your blood from clotting properly. Blood clotting is crucial for stopping bleeding when you get a cut or injury, and it's all thanks to proteins in your blood called von Willebrand factor proteins. Think of these proteins as the team captains that gather other players to form a clot and seal up wounds. In AvWD, your body either doesn't have enough of these proteins or the proteins aren't working right. This means your blood clotting process is slowed down, and you might experience sudden or prolonged bleeding. AvWD vs. Hereditary von Willebrand Disease. Von Willebrand Disease, VWD, comes in different types. Most types are hereditary, meaning they are passed down from parents to children. These hereditary types affect about 1 in 100 people in the US and are present from birth. On the other hand, AvWD is much rarer and doesn't run in families. Instead, it typically develops later in life as a result of other health conditions. So, while hereditary VWD is something you're born with, AvWD is often linked to other issues like immune system disorders or heart diseases. Symptoms of AvWD. The symptoms of AvWD can vary from mild to severe and can become more noticeable when you're injured or have surgery. Common signs include frequent or spontaneous nosebleeds, easy bruising, often large with lumps, heavy menstrual periods lasting more than 7 days, bleeding that lasts more than 5 minutes from minor cuts, prolonged bleeding after surgery or injury, heavy bleeding during or after childbirth, excessive bleeding during dental work, blood in urine or stools, bleeding into the skin and soft tissues. Who is at risk for AvWD? People with certain underlying health conditions are more likely to develop AvWD. If you have an immune system disorder, heart disease, or a blood condition, you might be at higher risk. Research shows that about 30 to 40% of people with AvWD also have an immune system disorder, and around 12 to 20% might have blood cancer, like essential thrombocythemia. Age can also be a factor since AvWD often develops later in life. Diagnosing AvWD. Diagnosing AvWD involves several steps. First, a doctor will examine you for symptoms like bruising and take a family history to check if there's any hereditary VWD. They'll then perform blood tests to see how well your blood is clotting and if von Willebrand factor proteins are working correctly. If your symptoms align with AvWD and you have an underlying health condition affecting your immune system or heart, a diagnosis can be made. Treating AvWD. There's currently no cure for AvWD, but it's manageable with the right treatment. The focus is on controlling bleeding and treating any underlying conditions. Treatment options may include hemostatic therapies, medications that help the blood clot and reduce bleeding, antifibrinolytic agents, medications that prevent the body from breaking down blood clots too quickly, factor replacement therapy, medications that provide von Willebrand factor proteins or help your body produce more of them, intravenous immunoglobulin, IVIG, medications to treat autoimmune conditions and increase platelet levels in the blood. Outlook for AvWD. The outlook for AvWD depends on the severity of the symptoms and any underlying conditions. While AvWD itself is not typically life-threatening, if it's associated with a serious condition like cancer, the overall outlook might change. Managing symptoms effectively and treating underlying issues are crucial for maintaining a good quality of life. Wrap up. Acquired von Willebrand disease is a rare but important condition to understand, especially if you are dealing with unexplained bleeding issues. By recognizing the symptoms and knowing the difference between AvWD and hereditary VWD, you can be better prepared to seek help and manage your health. If you think you might have AvWD or are at risk, consult a healthcare professional for proper diagnosis and treatment. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more health information. Stay informed and take care of your health.